Welcome everybody. This is Doug McCall with the International School Health Network, a member of the FRESH Partnership. It's my pleasure to welcome you to this session on promoting physical activity in schools in low-resource countries, and to welcome our speaker, Walter Cordero Barbosa Filho from the Federal Institute of Sierra, Brazil. Yeah. We also have one of his colleagues who's a participant in the work that Walter has been doing. And I'm just going to refer to her, Gisele, which is, so for participants, if you see on the left-hand side of your screen, there's a number of, it's a comment box, an instant message box, and if you'd like to ask a question or make a comment during Walter's remark, just type that in and then click that little arrow button at the very bottom there, and we'll come back to your questions and comments, and I will read them out loud to start off the discussion. So, and I've seen already a request from Caroline for the review, so we'll be able to post that after the session, so we'll be able to see the full text. And anything else in terms of comments or reviews, please post them as the session proceeds. So Walter, if you'd like to start us out with your presentation, and then we'll go to questions and comments, and then we'll look forward in terms of the next steps in this discussion. So Walter.
Okay. Thank you, Doug. Hello, all colleagues from the International School Health Network, the FRESH Partnership, and colleagues who are watching this webinar. As Doug told you, I'm Walter Barbosa Filho, and I'm a professor at the Federal Institute of Ceará, Brazil. I appreciate the opportunity to share with you information on promoting physical activity. This theme is interesting for me because as a physical education professor, I address this topic in my research and work. First of all, I will introduce the context I've been involved for teaching and research. I'm from Brazil, a middle-income country with an HDI of 754. The state I was born and I'm working nowadays is the Ceará state, this red part of the map in the northwestern Brazil. One state that historically has social and economic issues, for example, poverty and drought, which Ceará now has a HDI of 682. And nowadays I'm working in that series, that yellow part of the map, in the Federal Institute of Ceará at a campus in Boa Viagem, a municipality with a HDI of 5498, one of the lowest HDI of Ceará state. So as a physical education professional, as a research, as a citizen, I've been challenged to understand how to promote physical activity and how can we achieve this in low resource countries. The theme of the webinar is what we know. It's a challenging topic. What we know, what we need to know about promoting physical activity in schools in low resource countries. To attempt the topic, I will start talking about physical activity and the Sustainable Development Goals, and how this behavior is important to achieve the Sustainable Development Goals. After that, I will present our results from a systematic review that talk about physical activity interventions in school in low and middle income countries. This was a systematic review performed by my colleagues, including Gisele Minato, who is online right now, and other colleagues from Brazil and Portugal. And then I will finish to try to make some questions. Yes, there are main questions in this presentation in order to address this topic, what we know, because we need to know what we need to know. There is a lot of things we need to know about promoting physical activity in schools in low resource countries. In 2015, countries adopted a set of goals, 17 total, and to end poverty, protect the planet, ensure prosperity for all. The Fresh Partnership is quite interested in those goals, and two of them are particularly related to discussion of this webinar. The first one is related to health and well-being, which propose that actions should be done in order to ensure healthy lives and promote well-being for all at all ages. And our specific target is reduce mortality from non-communicable disease through prevention, treatment, and promote mental health and well-being. The fourth goal, another goal related to health promotion in school, is the goal 4, health quality education. And to target these goals, is important that our actions, actions as policies, research, and practicing, in order to allow that learners acquire the knowledge and skills needed to promote sustainable development and sustainable lifestyle. When you see those sustainable development goals related to health and education, we understand that physical activity can help people and society to achieve those goals, the 3 and 4 goals, because physical activity is closely related to health and education. But in 2016, during an International Congress on Physical Activity and Health, experts have published the Bangkok Declaration on Physical Activity for Global Health and Sustainable Development Goals, which describe targeted and actions in terms of physical activity and sustainable development goals. Here in Brazil in 2017, the United Nations Development Program have also published a national report on physical activity and health, which describe actions and programs here in Brazil for physical activity and health promotion and the sustainable development goals. In those reports, it was described how physical activity can contribute to achieving not 2 but 8 sustainable development goals, include not only the goals 3 and 4, but also the goals such as gender equity, and reduced inequalities. And for example of actions we should do in order to achieve the sustainable development goals, for example, for the goals about health and well-being, reports propose that policy actions across multiple settings should be done in order to increase the population levels of physical activity, and changing physical activity we can reduce non-communicable disease. And it's not about changing the behavior of the population, but also change environment aspects of physical activity in order to promote physical activity, to support and promote physical activity in different domains, such as leisure or transportation. About quality education, those reports also proposed policy actions focus on different aspects of physical activity practices, such as physical education curriculum, physical education programs, and also the environments. And these actions can contribute to improve education outcomes. It's not only about changing the behavior, but the proposed is the change in physical activity. We also can improve education outcomes. And this is particularly important to be done because it's a worrying estimate of physical inactivity worldwide. We see around 18% of adolescents did not meet the physical activity guidelines. Also, we can see here in the map that physical inactivity estimates in low and middle income countries are close or even higher than estimates from high income countries. For example, we see here in Brazil, in the map in Brazil, we can see a physical inactivity estimates higher than those from Canada and USA. Also, WHO has reported that the difference in physical activity levels are also explained by significant inequities in the opportunities of physical activity by gender and social education. So it seems that low resource problems, issues are related to the physical activity inequalities. But what do you know about promoting physical activity in schools in low-resource countries? That's what I'm trying to address now. We know a lot of things about promoting physical activity. Since physical activity is recognized as an important health aspect, and there is a lot of publication reports, institutional statement on promoting physical activity by WHO, but not by, but only WHO. National and international organizations are interested in propose action for physical activity promotion. But addressing the promotion of physical activity in low-resource countries is quite rare. In 2008, WHO published a report presenting strategies for promoting physical activity in low-resource countries. That report with the message what works on interventions on diet and physical activity. However, this report did not include relevant physical activity actions after 2008. Also, two systematic reviews were published addressing topics that include a few results about promoting physical activity in low-resource countries, because they are focused on a specific topic. For example, the first one from Christine Reuner talked about physical activity interventions in Latin America with different populations, as adults, older adults, and young people as well. And another systematic review published by Vestralen and colleagues focus on school-based obesity interventions, and they include just a few interventions, physical activity intervention in low-resource countries. So in order to fill this gap, my colleagues and I have published an umbrella systematic review about promoting physical activity for children and adolescents in low and middle income countries. This was an umbrella systematic review because we have two different aims. The first one was to analyze the previous reviews on physical activity promotion and discuss the inclusion of studies in low and middle income countries in those reviews. And the second aim of this systematic review was to analyze the characteristics and the level of evidence of the effect of physical activity promotion interventions, specifically from low and middle income countries. There were two comprehensive selection process of the studies that finished with 15 systematic reviews on promoting physical activity. We'll talk a little bit about it. And also the results of 25 different references that present 20 different intervention studies that were performed with children and adolescents from low and middle income countries. But when we are looking for when we are observing the results of the 50 systematic reviews, they include around 900 intervention reference on promoting physical activity in young people. As you can see in the figure, each bar represents the amount of physical activity interventions in each systematic review. For example, in Demetrio and colleagues, we can see 74 interventions. However, when we analyze the data from low and middle income countries, we found that only 3% of the interventions were from low and middle income countries. They are represented by the black bar of the bar, that part highlighted, this little part. Thus, we found that most of evidence mentioned in previous literature synthesis were not based on low and middle income country data. Thus, we did a selection process and we have found 20 different interventions in low and middle income countries, which were performed in different countries and continents. We found 6 intervention studies in America, which were performed in Brazil, Mexico, Ecuador, and Trinidad. Most of interventions, however, were performed in Asia, 9 intervention studies, which were performed in China, Iran, India, Lebanon, and Thailand. And also we found 4 interventions, 2 performed in African countries and 2 performed in Oceania. When we try to define evidence level based on the studies characteristics from the 20 different interventions. The first step, we try to define the evidence level based on the age of population. So we define the evidence level for children and adolescents. And we find that there is strong evidence that physical activity interventions can improve physical activity in adolescents from low and middle income countries. But inconclusive evidence was found for children because inconsistent results were found with this population. When we try to define the evidence level by intervention setting, we found strong evidence that skill-based interventions are effective in promoting physical activity in low and middle income countries. However, inconclusive evidence was found for school plus family-based intervention or community-based intervention, mainly because this kind of intervention settings the studies had small sample size, or a few studies were done so far. Considering the intervention duration, we found strong evidence that only short-term interventions are effective in promotion physical activity, but we don't know yet, the evidence is still inconclusive for long-term interventions because inconsistency results were found. We also find that this is found in different systematic reviews. We found strong evidence that multi-component interventions are effective in promoting physical activity. However, when studies focus on different kind of strategies, for example, curricular or educational intervention or environmental change, we found inconclusive evidence because there is just a few interventions or inconsistency results in those intervention studies. And finally, this is a particular finding, an interesting find of the systematic review, that we don't know yet there is inconclusive evidence of the intervention, in fact, based on the behavior focus on the strategies. Certain interventions were focused on physical activity, and they had consistent results. 3 out of 4 interventions had significant effect on physical activity, but 2 of them had a small sample size, an important evidence level criterion. 7 interventions had strategies focused on physical activity and healthy eating, but they have inconsistent results in changing physical activity. And a few interventions has strategies focused on health, lifestyle, and present results for physical activity. So based on the results of the systematic review, we know that there is a strong evidence that multi-component, school-based interventions are effective in promoting physical activity, but we know that this evidence when the intervention is focused on in adolescents. And the results of the systematic reviews also addressed as future studies and interventions should identify which intervention are effective, the effectiveness of interventions for children, and an important part, the long term of physical activity interventions. We will try to address what we need to know about promoting physical activity, and I think that suggestions for future studies also also are some aspects we need to talk a little bit about what we need to know. So besides the issues addressed in the last topic, when I mentioned it, the literature gaps, we need to think about questions on promoting physical activity in low research country. The first topic, I think it's probably the main topic, is to answer the question, how can we achieve the sustainable development goals related to promoting physical activity in low research countries? Reports and statements have made suggestions, but we don't have much practice-based evidence on this topic, particularly on low research countries. They are still rare here. For example, a question we need to think about it, we need to know is, do programs focus on physical activity reduce economic inequalities or gender inequities? Here in Brazil, some national programs are focused on physical activity in the population, include young people, but the results of the effective of them for reduced gender inequities or social inequities on physical activity is still unclear. Other suggestions were made based on a study which addressed the topic about research priorities aiming to improve adolescents' health from low and middle income countries, and this publication may help us to understand what we need to know about physical activity in low research countries. In the paper of Jason Nagara and colleagues, they asked experts on research priority in 8 different topics, including physical activity, as you can see. The survey enrolled 142 experts from all continents and who had different roles in the society, such as researcher, health practitioner, and policymaker, as you can see here and here. And the experts also were asked to define research priorities, including intervention research, and different kind of study designs, such as observational studies, but also intervention research. And the intervention research were organized in three groups. The groups that define discovery research about new interventions, the development and the testing research about evaluation of interventions, and the third one was related to implementation research, trying to improve sustainability and scale up of existing interventions. And as a result, the results of this survey was that 8 out of 10 questions were related to intervention research. Those expressed trend to define that research focus on physical activity in low and middle income countries are a priority. Research are a priority on this topic. Also, 5 out of 10 questions focus on school-based interventions, mainly because mainly focus on intervention implementation. And the research priority with the highest scores was that one. What is the best when they define the aspects of a best design? They mean like cost, acceptability, effectiveness, sustainability of a school-based intervention that aims to improve different physical activity aspects, when you can see such as the recommendation of physical activity, the number of physical education class, the active participation in a physical education class. So we need to understand what is the best design of a school-based intervention. But it's not about the best design, but it's also about the sustainability of physical activity interventions. For example, what are scaled and sustainable approaches to improve physical activity in children and adolescents, particularly in low and middle income countries, and how can affect local interventions be scaled up for national and cross-national intervention. We can see a lot of local interventions, but when try to scale up for varying cultural, social, and context, we see that the effectiveness, the implementation of that intervention are not good. So it's really important to define this as a research priority in low and middle income countries. And the message on scale-up intervention are also emphasized in a paper published by James Salis and colleagues in the physical activity series from The Lancet in 2016. They mentioned that we need to understand how we can scale up intervention across the varying cultural, social, and economic contexts. They mentioned that to achieve this goal, it's not a problem from the physical education, it's a multisectional, multidisciplinary action. We need to think in a dynamic and multisectional action. And also it's really important because it's really close to the Sustainable Development Goals. School-based strategies need to access the co-benefits for school outcomes, because we can see positive results in high-income countries, but we don't know yet these results in low resource areas, and this is really important for school officials. And this message about what we need to know, and we need to focus on this in order to promote physical activity, is in the draft of the Global Action plan on physical activity presented by the WHO in 2017. This global action statement proposed actions and strategies to promote physical activity in a global way, focus not only in create active people and focus on individual aspects, as you can see in the topic 3, but also to create an activity society as a cultural aspect, activity environment, and activity systems. And one of the suggestion of the draft is to strengthen parents and community-wide understanding of the importance of daily physical activity, the importance of physical education, and the importance of reduction of the sedentary behavior in children. We can see that, for example, physical education class or sedentary behavior impact on the health. It's not a common topic when I try to talk about health in schools here in the context of low-resource countries. So they address a really important topic in the global draft. So trying to answer the second topic is, what do we need to know? The suggestion is the United Nations proposed the Sustainable Development Goals, but we need to understand if and how we can achieve the Sustainable Development Goals related to promoting physical activity in low-resource countries. Also, it's not about effective intervention, but we need to understand how we can develop effective intervention across varying cultural, social, and economic contexts. We need to understand this. For this, it's not an action of a different, specific kind of professional, but it's necessary a multidisciplinary action. Enrolled by professionals from different areas in the society. And finally, we need to define actions. When I'm trying to say we need to think as policy, research, and practice in terms of research implementation, training opportunities, and research and development. This is a really important when I'm talking to policy, research, and practice, because this is a message presented by the WHO draft. That's it. This is the content I intend to address. I'm finished my presentation, Doug. Saying I'm really grateful to the colleagues from the Fresh Partnership for the opportunity of sharing our work on promoting physical activity here in Brazil. And before the discussion starts, I would like to say that our research group here in Brazil, the Research Center in Physical Activity and Health, is always available to contribute with the discussion and the work on promoting physical activity and health. Thank you very much.
Thank you very much, Walter. And I wanted to, I'm going to invite colleagues again to add comments or questions into the message box, and I'll read them out as we proceed. I had one, it's more of a comment, but I think it was something that's important to underline, and it was part of my learning curve a few years ago when I finally understood that saying that there is inconclusive evidence or not enough evidence is not the same thing as saying the intervention does not work. In other words, it simply means, especially with the rigor of systematic reviews, a lot of things must be excluded because of the quality of the studies, but it does not mean that that particular intervention or that particular strategy does not work. It means there's not enough evidence yet. Yeah. And so that's a very important understanding, I think, about research in general, not only about research in this particular context, but the scarcity of this research. The research in this context means that it's easier to end up with an inconclusive answer rather than a conclusive answer. So I also, Walter, I wanted to compliment you on how you've done the presentation of taking the research that covers all contexts and then started to apply it to the low resource country context. I think that's a really good way to go, and it fills the gap because most of the many documents, particularly in physical activity, which are all good and they're recommending good practices, but they state the general what we know for all contexts, usually high resource countries, but never really look at what you called in your paper, and I'm just quoting it, social, cultural, economic, and structural peculiarities of low and middle income countries. That's, I think, what we need to really better understand. And I don't know if you can go back to that slide that had the UN goals with the health goal in the middle. And as yeah, I think you just went by it. Go back there. Yeah. The I think as our understanding of the low resource country context is coming out, those factors that are expanded outwards from the circle are very important. Walter, in our conversations, as we looked more closely at your particular context in Brazil, and we talked about one type of physical activity in the school context, active transportation to school, and how that might be challenging for the communities that you work with. And maybe could you elaborate a bit on that, and then maybe we can have a discussion of that.
Yeah, Doug, it's really important this. We had some local interventions here in Brazil. The systematic review included just two interventions, but after the systematic review, we have already six interventions focused on promoting physical activity here just in Brazil. And one of them was performed here in Fortaleza, and we focus on healthy and active lifestyle. It's not just about physical activity, but sedentary behavior and healthy eating. And we found that some strategies focus on, for example, physical activity during the commute to school or commute to work. Some adolescents works here, even when they are 16 or 17 years old. And we saw that interventions in that particular physical activity domain, we need to think carefully about this intervention. For example, adolescent can't walk, can commute to school, even if he or she lives about 200 or 300 from the school, because it's really dangerous there. It's a violent area of the city. So this important aspect. We need to understand the aspects, the environment aspect, the cultural aspects of intervention on school before propose actions, strategies, but that can be effective. Another example of this is we built some sports squares in the schools, and we try to improve physical activity practicing during the free time in the school. But we are focused on one kind of physical activity, but children and adolescents used to use for another kind of physical activity, because it's a kind of physical activity they are interested in. They practice more in that particular school. So this is important because when we understand the context, we can propose a scale up and effective intervention strategies.
Thank you. And then that, just to expand that point a little bit, and we need to understand that even in the context of low resource countries, the context will vary. I had a chance to do a little bit of work in it's actually a middle resource country, Oman, and we visited some schools, and in Oman, in parts of the time of the school year, the temperatures reach 45, almost 50 degrees Celsius, and there are roofs over all the playgrounds for the schools, but it's just impossible really to think that people are going to go outside and run around in that heat. And then also the factor of the cultural, with the young women having to cover up. What are the gender-related aspects that need to be addressed, and to encourage young girls to be active and to participate in sports. So it really needs more study and more elaboration about the factors that are identified in the expanded sections of the UN goals there. So looking again for comments or questions from folks.
Hi, Doug.
Yep.
This is Caroline from Save the Children. Can I make a comment?
Absolutely. Go ahead.
Yeah, I was kind of intrigued about the map that, first of all, thank you. That was a very, very informative and great presentation. And there was a map which showed that Brazil actually had a little bit more. Now, that's the map about the number of studies, but there was one about the physical activity of young people, and that Brazil actually is a little bit better off than the US and Canada. Yeah, that map. And I was kind of wondering about data on what I suspect is a U-shape curve of the relationship between economic status and physical activity. So in very poor countries, I would have suspected that there's more physical activity just because children don't have the money to, to take a motorized vehicle to school, or because they're physically working in the fields. Now, if you look at the map in most African countries, you don't have any data. It's a white map because there are probably no studies. But it does look as if whatever that is, I guess Sudan has more physical activity, and so the poorer countries, just would have still more physical activity than the richer ones. But then as violence becomes to play in when poorer countries move typically more to a little bit more middle income, then physical activity actually goes down. And I was wondering whether there's a systematic review about that relationship. And I'm sorry if this is a totally naive question. Then maybe...
No. Please. It's an excellent one. It's a good discussion to have. Go ahead, Walter or Gisele. Do you want to respond to that a little bit? Well, maybe I'll jump in as they're preparing their comments. There's a picture on the second Global Education Monitoring Report. It's actually the kids are going to school. These nice little kids going across. It's an island context, so they're coming across these little bridges, and they have to walk a couple of miles to school every day. And they have their little school uniforms. It's a very attractive photo. But just thinking, so obviously, if the environment is safe, then walking to school is going to be more prevalent in countries poor countries that don't have their parents driving them to school in cars or buses. But it's not. I guess that was my comment about. It's not always that case because of the safety or the geography or whatever. We have to really sort of not treat low resource countries all the same, and we need to really look at the factors within the country that make a difference. And so that, going back to that diagram with so climate and geography and a variety of other things come into play. Walter, do you want to comment as well? Worried that we might have lost sound. I'm just going to check.
Okay.
Yeah. Sorry.
Okay, now I'm okay. I'm sorry. I turned off the microphone.
Okay. Great.
I think Caroline is right. The name is Caroline? Caroline?
Yes.
Yes, Caroline. It's a really good question because this is a common sense that in high-income countries we found physical activity estimates higher physical activity estimates, but when we see this kind of data, it's not easy to understand. First of all, the first topic I need to think to understand this data, it's what adolescents thinks about physical activity. Because when talking about physical activity as a concept, physical activity is any body movement that improves, that change your energy up than the resting energy expenditure. But people from middle and low-income countries, especially young people, sometimes did not understand what is physical activity. For example, when we are doing some surveys here, I already answered a question: is cycling or biking a physical activity? I answered this question. So some young people did not understand what is physical activity, and it's an important aspect to be focus on physical activity interventions in low and middle income countries as well, because sometimes we don't understand that domestic activity is a physical activity, or a transportation activity is a physical activity. So it's an important thing to think about it. And another point about this, specifically here in Brazil, we have about 8% of population in urban areas. So they live exactly like people live in high-income countries. Not exactly like, because we have the environment or some aspects related to technology aspects, but also we live with some development issues. For example, poverty or violence. So it's an interesting environment to understand the promotion of physical activity, because we are in a urban area with access to technology, even healthcare, but also we live with problems such as violence and this kind of thing that change all the way people can participate in physical activity.
Great. Thank you, Walter. Further questions or comments from folks? We're moving towards the end of the hour, but Carolyn, I see you responded saying that how people tend to not report physical activity or work if they're doing selling stuff in the street and they're walking, moving around. It's not associated with that. That's good. Other comments or questions from people? I had one which is related to your review, and it reflects the research where the concern over the last decade or so has been on the amount of physical activity that young people are participating in, and in the school context, it's trying to reach that goal of 60 minutes a day. But I wonder if other, and I see now recently, we monitor a lot of journals for our membership. And there's been a lot of research squeezing the minutes out of the school day in terms of having kids be active, which is a good thing. But I'm wondering, the research also seems to be shifting back to fundamental movement skills and attitudes towards being active and sport. And Walter, in your last few slides, you got into that in your comment about how do young people perceive physical activity. Is that something we need to explore? I read a little bit about physical literacy. I'm not sure that the way it's being discussed now is as holistic as we need to think about. But is sort of making sure that kids graduate from school, from primary or secondary school, being physically literate. In other words, having the fundamental movement skills, but also maybe having the attitudes and beliefs, behavioral intentions, feeling that they can control that part of their lives, kind of feeling, maybe even going into attitudes and belief about fair play and teamwork and so on. Is physical literacy a concept that we need to examine in this context, and does it need to be adapted so it's more culturally relevant to low resource countries? It's kind of a general question, but I think it's somewhere that the research on physical activity is starting to explore.
Yeah, of course. Thanks, Doug. These are a really interesting topic because when we are thinking physical activity as a dynamic behavior, we can see that both people who are active and they improve physical fitness or physical movement skills, but when we are physically inactive, we also have problems to be enrolled or to participate in physical activity for in order to achieve that recommendation of 1 hour of moderate to vigorous physical activity. So physical literacy is for sure an important aspect to be focused on these aspects. Also, we found here in our local intervention called Fortaleza Sua Saúde intervention, it's a Strength Your Health in Portuguese. This intervention, we found that if we change the attitude for physical activity practice, if you change the social support of friends and teachers for physical activity, we can change the physical activity behavior. So that's what Doug talked about. When trying to change the behavior of physical activity, we need to think the base, the aspects that are important to achieve or to be enrolled in that particular behavior. So we found here that intervention is important to, the intervention is effective to change physical activity behavior, but the part of the change pass through the change in attitudes, the change in social support for physical activity. This is a really important aspect. We also find here in another study that the change in physical activity, the change in the social support for physical activity explain the change in the educational outcomes. The results of this publication are this data analysis were not published yet, but we were finished the paper that described the effect of intervention pass through physical activity change and physical activity attitudes. So it's really important when we analyze this data, we found that part that Doug highlighted.
Okay, thank you, and thank you for bringing this review, the research priorities paper to our attention. I think for those who have been on several of these, as we move further in the fresh partnership discussion of the low resource countries, that article is a really good one to go and take a look at in terms of research priorities for low resource countries as we move along in this discussion. Most often it's about particular topics like physical activity and so on, but it also maybe there's a body of knowledge that needs to be developed through active research in this context, and that article did actively consider low resource countries in their discussions. So it's very, very helpful to know about that. Further questions or comments? If not, I'm going to Walter. I'm going to try to pull up the, and I don't know if I need to request control of. I'm going to click on a button here, and I'm going to share my screen. I hope. I hope. and I hope that you're going to see a document. Okay, you're seeing my screen now. I'm going to turn to, hoping you're seeing a page outline for summary and statements. Walter, is that what's showing on the screen? Walter, you'll need to click on the mic if...
It's a problem for me.
What's on the...
Okay. Okay, thank you. I'm seeing your screen now.
Okay, so...
I'm sorry, I'm really sorry.
No, just no, because I'm out of my, I can't see the screen when I'm in this mode. I don't think it's learning about how to use that technology. But we're as a follow-up to this session, we have been inviting a number of people, including Walter and Gisele and others, to work with us to do a report. It's not going to duplicate with the excellent review that Walter and his colleagues have done, but we've been drawing from various resources and reports, not research, to try to put together a summary statement about what we know and need to know about physical activity in low resource countries. And these 10 points are the kind of the outline of that paper. And it's you can see that they're all fairly logical. Understanding the problem, we've item number 2 there we've spent a lot of time on, and item number 5, the use of individual and 4 multi-component approaches, is really what the research 4 and 5 are usually what the research covers, and we're beginning to understand that we need to look again more deeply into question 2. And my bias is that we need to think more about 8 and 9, integration within the educational system and using system science and organizational development concepts and tools. But we're using that outline to scan through the reports and research, and we've been obviously drawing from the paper that Walter and his colleagues have done. So we'll be sending out an invitation to review that report. It's a report that's being prepared for Plan International UK. It's a funding. They have funding from their Young Health program, and it's allowed us to do this search. And I think, Walter, as you found in your research review, that most of the discussion is about high resource countries or generalized. But by digging into the various regional reports, we're often able to find country reports that do make a comment. So I just invite people to watch the Fresh Partnership website for that when that paper is being developed. It's in a Google Doc format, so people can go online, make a comment, and we'll keep multiple versions as we move through it over the next couple of weeks. And I'm going to now just not share my screen, I hope. I'm trying to go back to the. I'm not seeing how I get out of this. There it is. Okay. Yeah, there we go. Stop sharing. And Walter, if you wanted to take back the screen for your final remarks, that would be great. I think do you have a thing at the top saying take control or something like that?
Just a minute then. Oh.
Sorry, maybe that technological glitch there. Maybe Walter, rather than. Oh, there we go.
Yeah.
Okay, there we go. That's great. So, Walter or Gisele, any further comments about your work and thoughts for as we finish up the session?
Okay. Thank you,
There's
Doug.
a question from Gabriela from the Argentinian Ministry of Health.
Thank you. Yes. What definition? Okay, this is a question on what definition of physical activity do you use, and the WHO doesn't consider energy cost cut point. We're thinking they are considering the definition of redefinition of physical activity is important for a better understanding. And this is from Argentina, from the Health Ministry. Walter, do you want to respond?
Yeah, it's a really good question, Gabriela, because we have a common definition of physical activity used, proposed by Kaspersen and colleagues. But we need to understand physical activity as a human behavior. So we not focus on just activity that has energy expenditure. So we are not focused on, for example, in aspects, for example, the social support or the enjoyment of physical activity during the practice in schools or in the neighborhood. So during the draft of physical, the WHO draft, we also see the Kaspersen definition of any body movement that increase your energy expenditure. So most of research are based on that definition, but I believe, and this is my opinion, and that the definitions focus on the human behavior, and for this we add for aspects for the attitudes or habits, for the enjoyment, the knowledge, skills, the physical literature, for example, the social support. We are close to a social ecological approach of physical activity promotion and a dynamic approach of physical activity promotion. So the draft trying to define to make the definition of a physical activity, but also we can see during the draft the actions based on individual aspects, activity people, but also we can see as active system or active environment and aspects from the socio-ecological aspects. So in my opinion, the definition of physical activity is that one, and the common definition is that from Kaspersen, but during our interventions we think different from the aspects of the body movement that increase the energy expenditure. We think beyond that definition.
Thank you, Walter. And Gabrielle had another comment. Have we had contact with the Global Matrix Project? I'm not familiar with that. I'd be happy to follow up on that. But Walter, have you? Is that part of the response you just gave? Are you familiar with the Matrix Project?
Yes, I know the Global Matrix. But I didn't see the question. Oh, the question is if I'm familiar with the Global Matrix?
Yes. Yes.
Okay. Yes, I'm familiar with the Global Matrix. Here in Brazil, there are two different. So the global aim of the Global Matrix is to observe the results, the estimates of physical activity aspects in the world. So there is a group working with results from adults and older adults, and another group working with the results of children and adolescents. The Global Matrix here in Brazil is headed by Diego Silva from the Federal University of Santa Catarina, and we are working. I'm the working group, working to estimate this kind of health and physical activity outcomes here in Brazil in order to define the scores, the grades of this health and physical activity estimate. So this is the purpose of the Global Matrix. We see what the studies about physical activity are estimating. For example, here in Brazil, the grade is not that good for physical activity, or it's good in comparison to another countries. So this is the aim of the Global Matrix in general.
Thank you, Walter. And follow-up question, what do you think of the physical activity questionnaires for children?
Yeah, it's not that good. It's not that good. I think this is the problem that in that map from the worldwide estimate, because we are using just one questions that includes different domains of physical activity, that includes different aspects of the estimate of physical activity. In one questions, children and adolescents need to think about frequency, about intensity, about the duration, about different types of physical activity. So it's not easy to estimate this construction if you are estimating one single questions. That's I see about this. But this is the item used to estimate the physical inactivity globally. So the problem I see when I'm using this item with children and adolescents here probably is the same problem, the problem that people used to see in Argentina, in different countries in the world.
Great. Thank you, Walter. And thank you, Gabriela, for your excellent comments at the end. And so I'm going to be finishing up the session. Again, thank you, Walter, for the excellent presentation and the great discussion that we've started. If folks would like to participate in the review of that paper that we're going to be working on, it's really a summary of just a couple of pages. You can just send me an email to the email address I've posted in the chat box, and I'd be happy to add you to the list. We'll be preparing that summary in the next week or two and sending it out for comment, and it eventually be part of the knowledge bank that we've been developing through the series of webinars with the FRESH partners. It's a pleasure to have been on this session today. Walter and you and your colleagues have done an excellent contribution to the knowledge about this, and we'll be adding some of this discussion to the evergreen document we have about our growing understanding of this particular context. And as we discussed this before, I think you've helped move us towards a bit of a research agenda discussion, which I think is a very important piece. So I'm going to just shut up.